Okay. Welcome everybody to Town Hall number 11. We have a special guest with us today to speak to us about suicide self-poisoning in youth. Our guest is Gayle Finkelstein, Northern New England Poison Center's Vermont Education Coordinator. We're grateful to have you here with us today, Gayle. If you have questions as they come up, put them in the chat. We will address those if time allows at the end of Gayle's presentation. Thank you. Gayle, you can go right ahead.
Okay, well, thank you guys for having me. So this presentation is on self-poisoning, suicide attempts in youth. And I'm the Vermont Poison Prevention Coordinator for the state for the Northern New England Poison Center. So next slide. Next. So the overall goal of this presentation is to increase awareness of suicide, self-poisoning attempts in youth. Suicide is preventable, and it is important to understand the risks, be aware of the national, regional, and local data related to youth suicide self-poisoning, highlight recent research, and discuss prevention efforts. This presentation will review the data and trends of youth self-poisoning, and will examine the products most often used in youth self-poisoning attempts. Knowledge of the most commonly used suicide methods is important to develop prevention strategies. No single approach can make an impact on suicide. It requires coordination and collaboration from many different sectors of society, including education. Next. So let me begin briefly by reviewing the Northern New England Poison Center. I'm sure that most everyone here is familiar with us. Hopefully everyone has gotten a chance to call us at some point. The Northern New England Poison Center provides a wide range of service to our region. It covers the states of Vermont, New Hampshire, and Maine. It's federally, state, and locally funded. We receive approximately 300 calls per day from Vermont, Maine, and New Hampshire. And Vermont residents and healthcare professionals can call to receive free, confidential poison help from a medical expert 24/7. We have 2 board-certified toxicologists that are available at all hours. We also offer interpretation services and online chats with poison experts, and callers can contact the Poison Center for reasons including information requests, general poison prevention questions, pill identifications, and information on possible medication interactions. If a person needs further medical intervention in a hospital, the Poison Center works closely with hospitals to provide toxicological support. Our highly trained staff consists of nurses and pharmacists certified in poison information, and as I mentioned before, 2 board-certified doctors trained in toxicology. In addition, the center consists of other specially trained healthcare professionals and has an educator for each of the 3 states. If you haven't had the opportunity to contact the Poison Center for questions or potential exposures, I suggest that you think of this resource next time you're in a situation that you need fast, accurate, and up-to-date information. So it's important to note that the data the Poison Center receives is only a subset of the national picture. It actually underestimates the actual number of suicide attempts by self-poisoning in our region, because not all the calls, all the exposure calls we get are reported to the Poison Center. It's only the calls that either a parent's calling about, a healthcare provider's calling about, someone in a mental care facility is calling about. So calls that are going, patients that are going to the emergency room or just going to the doctor, we don't get those calls. So emergency room and hospital data need to be factored in to get the full picture of this public health crisis. We also need to factor in clinics, outpatient facilities, and physicians' offices, which are not reflected in our data. Okay, next slide. So there's some interesting research that has focused on suicide risks following intentional self-poisoning and studies looking at specific drugs and trends in self-poisoning, such as this Australian study focusing on trends in self-poisoning and psychotropic drugs in youth. So just to let you know, any of these studies that I'm sharing today, I can send you links to. One of the 2 studies I will be highlighting in this presentation is from the Journal of Pediatrics, entitled Sex and Age Specific Increase in Suicide Attempts by Self-Poisoning in the US among youth and young adults between 2000 and 2018. This was a retrospective study involving reviewing the data from all 55 poison control centers nationwide during the time period. As a school nurse, you should be familiar with this data because some of your students may be at risk of self-poisoning. Next slide. Poison centers enter their calls into the National Poison Data System. And so when we get a call from someone, whether it's a school nurse or a healthcare provider, that exposure call or information call is uploaded into a national database in near real time. So it goes in almost every 10 minutes. So the National Poison Data System defines intentional suspected suicide as an exposure resulting from an inappropriate use of a substance for self-harm or for self-destructive or manipulative reasons. Using data from the National Poison Data System, which reports information from all 55 poison control centers across the country, researchers found more than 1.6 million children and young adults aged 10 to 24 years of age attempted suicide by poisonings between 2000 and 2018. Significant increase in rates of attempts was driven predominantly by girls and young women between 2011 and 2018. A total of 71% of all cases reported in this Journal of Pediatric Study involve females. Self-poisoning is the most common way that someone attempts suicide, and the third most common method is suicide in adolescents. In children less than 19 years of age, the annual number of suicide attempts by self-poisoning doubled from 2000 to 2018, and serious outcomes increased 235%. So again, these are just calls that poison centers are getting across the country. The greatest increase in rate and number of serious outcomes occurred in the 10 to 15-year-old age groups. Both the number of cases per year with a serious outcome and the percentage of total cases that resulted in serious outcomes increased. Overall, suicide attempt rates increased with a significant increase in suicide attempt rates in children less than 18 years of age. Okay, next slide. So in the same study, looking at youth, again, aged 10 to 24 years of age between 2000 and 2018, from exposure calls from all 55 poison control centers nationwide, the most common substance involved in poisoning attempts that most often resulted in serious medical outcomes were over-the-counter analgesics, such as acetaminophen, ibuprofen, and aspirin, followed by antidepressants, antihistamines, and antipsychotics. In children 10 to 15 years of age, ADHD drugs were common and had the highest risk of serious medical outcomes. There are over 6 million children in this country aged 2 to 17 years of age diagnosed with ADHD. And more than 60% of these children are prescribed medications. So these drugs for ADHD are widely available. Opiates only accounted for 7% of the cases with serious medical outcomes and decreased significantly in the 19 to 25-year-old age group after 2012. Sedatives and hypnotics, primarily benzodiazepines, were used most often among older age groups, so the 16 to 25-year-olds. 24.5% of the patients in this retrospective study had a serious medical outcome, and the proportion of exposures that resulted in a serious medical outcome increased with age. For the age groups of 10 to 18 years of age, there was a significant increase after 2011, influenced mainly by females. The study also showed that rural areas had a higher rate of cases reported. The study also showed that seasonality effects were seen with the highest rates of suicide attempts occurring in spring and fall among adolescents aged 10 to 18 years. There was not a decrease for 19 to 21-year-olds. And for 20 to 25-year-olds, it actually increased during the summer months. Again, these are calls that poison centers are getting. These substances being used in poisoning attempts can be purchased easily and are considered safe at therapeutic doses, but in large doses, they can have some serious health effects. So the findings in these studies are actually consistent with emergency room hospitalization data and epidemiological data among suicide attempts in youth. Okay, next slide. So another recent study in 2020 in the Journal of Pharmacoepidemiology and Drug Safety reviewed just suicide-related over-the-counter analgesic exposures reported to poison centers in the United States during the same time period, 2000 to 2018, but we're now just looking at OTC analgesics. The rate of suicide-related OTC analgesics cases are increasing, a trend, again, that was primarily driven by the increasing exposure rates among 6 to 19-year-old females. Acetaminophen and aspirin cases are associated with greater morbidity and mortality. Acetaminophen was the over-the-counter analgesic medication most frequently associated with suicide-related exposures reported to U.S. poison centers, accounting for 48% of cases and 64.5% of deaths. exposures to aspirin have the greatest odds of serious medical outcomes and healthcare facility admissions. Most cases involved a single substance. So poison centers looking at just analgesics over the counter, 67.5% involved just a single substance. And 72.7% of those were females, and 49.7% of those were individuals 6 to 19 years of age. Overall, the rate of exposure increased significantly by 33.5% from 2000 to 2018. From 2000 to 2018, exposure rates for acetaminophen and ibuprofen increased, while that of aspirin decreased. Okay, next slide. So this is another study. This is a cross-sectional study that examined the association of drug classes consumed with the lethality of intentionally self-inflicted drug overdoses for all ages, not just youth. So I really want to emphasize they're looking at all ages here. This is not poison center data. This study actually analyzed emergency department visits and inpatient discharges from 11 states, as well as healthcare cost and utilization project national-wide discharge samples from January 2011 to December 2016. Researchers suggest that lethal drug access is especially a significant issue with youth because they usually take whatever drug is accessible. Adults were much more likely to use higher lethal drugs in their self-poisoning attempts. The drug mixes chosen by youth and adults differed. Like I mentioned, youth poisoning suicide attempts were much more likely to include non-opioid pain relievers, antidepressants, and anti-allergic or antiemetic drugs. This is similar to what the National Poison Center data revealed in their study. In contrast, attempts in adults were more likely to include alcohol, benzodiazepines, cocaine, opioids, and drugs to treat chronic conditions. Okay, next slide. The overall suicide attempt rates nationwide, like I mentioned, are on the increase. Like I mentioned in the previous slides, self-poisoning suicide attempts are being driven by girls. There has been a significant rate of increase in youth less than 18 years of age. The increase in severity of suicide attempts is independent of age or sex. 1/3 of intentional suicide patients resulted in a serious outcome. There is no causal explanation. Many factors play a role. Psychosocial, technological, and economic factors may contribute to this increase. While this specific study cannot point to a specific reason behind the increase in self-poisoning, it was noted that social media and the internet use have increased significantly during the same period. Suicide is rarely the result of a single factor. There are some common reasons that may contribute to suicide, such as a student's emotional health, like depression. Other factors may involve personal challenges, such as relationships, alcohol and drug use, illness, and social isolation. It is important that during a stressful time like this pandemic, that students have positive human connections and have resources available to them. Next slide. So we just pulled this data together. This is interesting. This is Poison Center data for Vermont. And we're looking at negative health effects related to COVID-19 pandemic. And among the negative health effects related to COVID-19 pandemic are concerns about increased risk of suicide. So we probably won't know COVID's impact on the nation's suicide rate for a few years until all the data is collected. Our Poison Center reviewed some of the data between March and November of this year and compared it to the same time period for the past 3 years, so for 2017 through 2019. And you can see that there were a few spikes in February, June, and October, but still it trended below the 2017-19 average. Okay, next slide. And for the 10 to 19-year-olds, there hasn't been a big change this year. So when you look at the ages of 2020 and the 2017 to 2019, 10 to 19-year-olds really, they dropped a little bit in 2020, but not really significantly. The only age group that actually increased was 60-plus-year-olds during this time period. But again, remember, this is only Poison Center data. The August 2020 Morbidity and Mortality Weekly Report from the CDC and the JAMA Psychiatry April 2020 article discussed the potential increased risk of adverse outcomes on suicide due to social isolation and distancing during the pandemic. One study revealed a significant number of those aged 18 to 24 years of age reporting having seriously considered suicide in the past 30 days of taking the survey. Even though our poison center data hasn't seen this increase to date, it should be something to be aware of, especially as we get more data. Okay, next slide. Okay, this chart shows the Northern New England Poison Center, Vermont self-harm attempts from 2009 to 2019. So you can see an upward trend through 2018 for all ages. And then we broke it down also for 13 to 19-year-olds. It dropped slightly in 2019. We're not quite sure why. And we need to wait for 2020 data to include to see if this trend is still increasing or is on the decrease. And again, remember, this is just Vermont Poison Center data. Okay, next slide.
If I could just, there's a question in the chat
Yeah,
box.
sure.
It says, is this Poison Center data only for just this year or for all NNEPC trending?
This data is for, well, this data is looking at 2009 to 2019. And so this is just Poison Center cases coming from Vermont.
Okay, all right,
Okay.
thank you.
Yep. Okay, next slide. So here you can see it's broken down now by age. Again, this is Vermont suicide attempt calls from 2009 to 2019. The exposure calls we're receiving for you 13 and 19-year-olds are trending upwards and have the highest rate compared to the other age groups. Hopefully, can everyone see the full slide for 2019 as well? But so you can see it is trending upward for 13 and 19-year-olds. Okay, next slide. So intentional self-poisoning is a significant cause of injury in Vermont. Incidences of intentional self-poisoning have been increasing over the past decade. The Northern New England Poison Center has managed 151 cases of self-poisoning among teenagers 13 to 19 years of age in 2019 in Vermont, just in Vermont, 76% more than in 2009. These numbers align with the national trend of increasing self-harm attempts among children and young adults, particularly girls and young women. Research suggests that the first episode of deliberate poisoning is a strong indicator of subsequent suicide and premature death. Suspected suicide attempts for all ages accounted for 47% of calls from healthcare facilities in Vermont in 2019. Okay, next slide. Okay, so from the 151 cases reported in 2019 from 13 to 19-year-olds in Vermont, patients attempting more often were female. 83% of the calls came from healthcare facilities. 7% came from own residents, 5% from mental health facilities, 3% from EMT and ambulance, and 1% from other. The most common reason for a healthcare facility call to the Poison Center is suspected suicide, and that's at 51%. Self-harm attempts are always referred to a healthcare facility to ensure proper medical and psychiatric evaluation. So anytime someone calls us outside of a healthcare facility, we will contact the hospital. Most often, the substances involved are OTC product or someone's own psych medicines that are easily available, like we mentioned in the studies. Okay, next slide. Okay, so as mentioned earlier, in 2019, we managed 151 cases involving teens in Vermont attempting self-harm. These cases involved a total of 219 substances. The most common category was antidepressants, which was at 20%, non-opioid analgesics without sedatives like aspirin at 18%, antihistamines at 9%, non-opioid analgesics with sedatives like Tylenol PM at 6%, and then cardiovascular drugs at 5%. And 5 of these cases were drugs used to treat ADHD. So this is a little bit different from the national data I shared looking at all 55 poison control centers across the country, because our number one for Vermont ended up being antidepressants. Okay, next slide. So now when we break down the number of substances per case of suspected self-harm in Vermont for 13 to 19-year-olds in 2019, we found 72% involved one substance, 17% involved 2, 7% involved 3, and 4% involved 4. So again, this is in line with the national data when we reviewed all the cases, that the majority of cases were single substances. And if anyone ever wants to get data from the Poison Center, just to let you know, you can contact me, and we can do it by county. We can break it down by sex, by age, by substance, if you're interested. Okay, next slide. So this is not the most recent. Actually, it was November's up now, but it didn't change too much, so I kept this one. This is from the Vermont Department of Health, and it's looking at overall suicide death by age and sex. For all means of suicide attempts, younger and older Vermonters may be disproportionately affected. In Vermont's Youth Risk Behavior Survey, it revealed that LGBT students and students of color were more likely to make a suicide plan or attempt. Okay, next slide. Okay, this chart is from the Vermont Health Department, and this is looking at intentional self-harm hospital visits in Vermont. And poisoning was #1 reason for these hospital visits between 2016 and 2017. Unfortunately, that's the most current data that I could get from the health department right now. Poisonings accounted for 57% of intentional self-harm hospital visits. And following poisonings, the leading causes were cutting, other, firearms, and fire. Females are significantly more likely than males to visit the hospital for intentional self-harm by cutting or poisoning. And this is for all ages. Okay, next slide. Okay, this is the leading cause of intentional suicide in Vermont. Poisoning is #3. Again, this is health department data, after firearms and hanging and suffocation. So the slide before was looking at hospital visits involving self-harm. This is looking at overall intentional suicide in Vermont. And so with that, poisoning is ranked #3. Suicide and intentional self-harm are priorities in the Vermont State Health Improvement Plan. Based on the data, they are focusing on targeting populations and counties to work with in expanding suicide and intentional self-harm prevention efforts. Some of these include 15 to 24-year-olds and females. And this morning I was actually on a conference call for a meeting with the Vermont Suicide Prevention Coalition, and they were sharing some of the stuff they're doing. And one of the health department was mentioning that they received a grant from the federal government, and I guess it's a 5-year grant, and they're going to be working on suicide prevention in the state. So hopefully they will involve these younger age groups and look at females. So I also want to mention, and I apologize that I didn't include this national chart, but I was looking at the CDC data and Whiskers data, and Whiskers data is hospital like ED data. And it was showing self-harm poisoning ranks #3 for 10 to 14-year-olds and #2 for 15-year-olds for leading cause of non-fatal violence-related emergency department visits in 2019 for both sexes. So #3, it was ranked #3 for 10 to 14-year-olds, and it was ranked #2 for 15 all the way through 60-plus-year-olds. It also showed that in 2018, suicide was ranked #2 for 10 to 34-year-olds as the leading cause of death. Again, this is a national CDC data. Okay, next slide. And if anyone wants that, I can send that to you as well, or the link. So my role as state educator with the Poison Center is to provide education for healthcare providers, educators, law enforcement, and public health, and promote the message that suicide is preventable. This includes developing podcasts, webinars, and fact sheets, establishing partnerships with coalitions such as health educators and school nurses to provide data and highlight concerning trends, increase awareness and advocacy at the State House, develop training modules for medical residents, and target health providers to increase awareness. Creating protective environments such as safe storage and safe disposal of medicines is one key message that I highlight whenever I discuss medication safety, including locking up drugs prescribed to any family member if they can be lethal in an overdose. So really want to emphasize that anybody, any family member, drugs should be locked up if the drugs can be combined or be used separately and be lethal in an overdose. Parents of children with depression or who have multiple risks should compile a list of all their family's medications and ask their pharmacist to check for drugs that are likely to be lethal if combined in an overdose. Again, really important to emphasize. Prevention strategies should include monitoring children when taking medications that have the potential to be misused or abused, and knowing where to go for help. You as a school nurse play a key role in identifying those at risk and providing support and prevention strategies to reverse this growing public health crisis. The Poison Center's educational materials related to self-poisoning in youth include a fact sheet, which includes a snapshot of suicide attempts in Vermont. And right now, this one's 2019, but we're updating it for 2020. And I've actually been sharing this with state representatives. In addition, we've developed a podcast and a webinar, and I will include the link to the podcast at the end of this presentation. This podcast was geared for healthcare providers and educators, not for the general public. And it was done at UVM Medical Center, and we had Dr. Rebecca Bell, who was a pediatric critical care physician, and Dr. Tom Delaney, who was an epidemiologist, who was on the podcast as well. So we're actually in the process of developing another recorded webinar for the general public. This one will be a little bit different because with that, we don't want to include the drugs, substances that are being used, like I'm mentioning in this presentation. The image on the right is the Vermont Suicide Prevention Center Suicide Help Reference Card. And we have our Poison Center logo included in that reference card. And you can download that, or I guess, or order that through their website. Okay, next slide. So one of the roles of the Poison Center is to provide data, like I mentioned. This national database is managed by the American Association of Poison Control Centers, and the information about these cases are uploaded in near real time to the National Poison Data System. And I had mentioned it goes up almost every 10 minutes. Types of questions a call taker will ask, and you're probably familiar with this if you've ever called us, are age of the patient, his weight, substance used, gender, reason for exposure, method of exposure, clinical effects, medical outcomes, management site, and site of caller. The Poison Center also manages exposure calls, provides toxicological support, and answers questions. They also work with the media. And we have our prevention program's mission is actually to advance evidence-based poison prevention, to decrease poison-related morbidity and mortality. We aim to achieve that goal through collaboration, education, promotion, advocacy, and expert guidance. The Poison Center partners with community agencies to prepare for and respond to emergencies and provide real-time public health surveillance for outbreaks, mass poisonings, and poisoning trends. Okay, next slide. Suicide attempts, particularly non-fatal attempts, are the most powerful known risks for a completed suicide. An analysis of suicide attempts self-poisoning by county will help target prevention efforts. It will be important to determine the gaps between hospital and poison center data. And this is really crucial because to get the overall picture, we really need to have the most updated hospital data. Self-poisoning is a major method of suicide attempts with a high rate of psychiatric consultation, low mortality rate versus other methods. The prevention of suicide death for suicide attempts may focus on self-poisoning, which is the major method of suicide attempts. Targeting hospitals and medical staff by substances used to increase awareness and provide educational materials to patients may provide beneficial on reducing suicide-related exposure to these OTC analgesics in the United States. So my hope is to really go out and reach out to healthcare providers, share the data that we're getting, not only for young kids, but also for the older adults, to show that what we're seeing at poison centers, to make them aware of the potential for self-poisoning so they have the education and they can educate their patients. Future research should evaluate the effectiveness of implementing unit dose packaging requirements and restrictions on package size and quantities for products like acetaminophen and aspirin products. Okay, next slide. So these are some of our policy messages. They should include promoting the message that suicide is preventable, increase screening for suicide risk and access to suicide prevention care, create long-term and sustainable intervention and treatment programs, ensure that medical coverage is included in insurance policies, increase provider coverage in underserved areas, and institute crisis intervention training in schools. Prevention efforts should include implementing packaging restrictions, like I mentioned, on package quantities for over-the-counter analgesic products. The CDC recommends a public health community-oriented approach that combines a variety of strategies such as teaching coping and problem-solving skills, promoting positive social connections, training people to recognize and act when they see someone at risk, and decreasing the stigma associated with mental health. Next slide. So you can contact the Northern New England Poison Center by calling our toll-free number, 1-800-222-1222, You can text poison to 85511, or you can visit our website at nnepc.org for a live chat. So remember to program the Poison Center number into your phone. Here are some resources that you should be aware of with and share with your students and parents. In response to a growing suicide epidemic, oh, and I guess next slide. But here are the resources. So I don't know if you're aware of this, but in response to the growing suicide epidemic, the federal government approved a new national 3-digit number, 988, that will connect callers to the National Suicide Prevention Lifeline Crisis Center. And this will go into effect July 16th, 2020. Actually, I think it's 2022. So these are some of the other resources that are available. Okay. And we also have the crisis text line. You can text VT to that number. And obviously Vermont 211. Okay, next slide. So these are some of the resources that I mentioned. So the that's a self-poisoning podcast. If you're interested and want to take a screenshot, or I can send you the link. That is the WHO, the World Health Organization, has some very interesting informational fact sheets and details on suicide prevention. The Spiller study is the one I mentioned, looking at age and sex from poison centers across the country from 2000 to 2018. And that was in the Journal of Pediatrics. Next slide.
Gayle, if I have your permission, I'll be able to share. Can I share this whole presentation with everybody? Can we post that on the website?
Yeah, as long as it doesn't go public I just don't want, the general public and children to get a hold of it. But yeah, sure, you can send it to anybody, any school nurse.
Okay, so they'll have to request it then, because I won't post it on our website then, but they can request the information. Okay, that's fine. Thanks.
Well, on your website, can anybody, like a parent, download it?
Yeah, it would be public from that standpoint.
Okay.
Public, so we can share it out with nurses if they request it.
Okay, that's better. Okay, next slide. So this is the other Spiller study that I mentioned. This is looking at the substances used from poison centers across the country during that same time period for 10 to 25-year-olds. And then the Miller study was looking at the lethality of suicide overdoses, and that was in JAMA of 2020. I think I have one more slide. That's me. So if you have any questions, you can contact me either by cell phone or my email, or you can call the Poison Center directly and they can give you my information if you don't have this. So do you guys have any questions? I know it was a lot of data that I pulled together, but it's, I think, very interesting to see what's trending and to see that what we're seeing both locally and regionally is similar to what's trending nationally. And it also is very similar to what emergency room data is showing and hospitalization data is showing. So hopefully it was some interesting new information for you guys. You guys have any questions? And I really apologize for having to read my notes and having to look down the whole time, but I was unable to somehow get this on the screen. So hopefully that was okay, but sorry.
If you do have questions, on the bottom by your participants button on the bottom of your screen, you can raise your hand and we can call on you there. Gayle, thank you so much. This has been incredible information.
And just to let you know, I do have a, unfortunately I didn't include it here, but I sent Becca a Survey Monkey for an evaluation. So hopefully she'll send it out. And if you guys could fill it out, I'd really appreciate it, because we really do use that information for grant purposes. So that's really helpful. It's very short, it's like 5 questions.
Gayle, I do have a question from the chat box. Are you seeing poisoning with or hand sanitizer?
Yeah, we've had an increase in calls since March on hand sanitizers and disinfectants, cleaning products. It's gone way up. And that's the case for all the poison centers across the country. So we do have some information too. I mean, I know it's off of, well, self-poison, I guess you could attempt. I don't know if anyone, actually, if someone has attempted suicide, self-poisoning, not so much children, but I know out west there was a couple of cases and actually a death in Arizona from someone drinking hand sanitizer. But we do have some information on that. So if school nurses are interested in that, we do have some information on hand sanitizer. We actually have a whole COVID fact sheet, and I developed a COVID video. If someone is interested in that, it's very short, that I could share with people or send it to you, and you could post it. And now you could post easily on your website, which would be great because it would be good for the general public as well.
Yep, that'd be great. So if you send those to me, Gail, I can get those out. I can share those on our website for all the folks.
Oh, good. That'd
Any
be great.
one of those resources would be great.
Okay. And I really do encourage everyone to watch the podcast that I recorded with Dr. Bell and Dr. Delaney. I think it's like 20 minutes, but it really goes over in detail. I mean, a lot of the information I share with you, but then they also have the hospital data that they're talking about, and you have the perspective from an epidemiologist and a critical care pediatric physician. So I think that school nurses might enjoy that.
There is another question in the chat box is, do you still do presentations for schools? And if so, can you do this remotely? And can they just request those?
Sure, anytime you want me to. I mean, I'd be glad to do it. I've done a lot in the past on, e-cigarettes. Actually, I'm doing one for you guys in January on e-cigarettes and vaping, again, at the end of the month. But yeah, I'd be glad to present anything. I mean, I'm home, so I can't travel. So if anyone wants presentations, I'd be glad to do that.
Thank you. That's very helpful. Okay, I'm not seeing any more questions in the chat, and I'm not seeing any raised hands. So Gail, I want to thank you very much for coming and sharing this information with us today. Thank you so much for your time and the energy that you put into the work that you do with the children that we all love and care for. So thank you.
Yeah, sure. So thank you so much again for having me. It was a nice opportunity to share this. So,
all right.
Everyone have a happy holiday, happy new year, and I'll be speaking to you guys again in January.
Thank you.
Okay.
So Soph, if I could make one other announcement, I sent out emails to anybody that's expiring either in November or December that have anybody that has their memberships that are expiring in the next month or so. I sent emails out to everybody individually, so hopefully they got those. And we're trying to do that now so that we can get a reminder out that that's coming up. We're trying to do it 30 days in advance. NASM is doing it too, but I'm not sure if those are getting through. It might be getting blocked somehow or mapped somewhere else. So if you have any questions, you can always reach out to us and let us know if you need any help with that. Thank you.
Because we really don't want you to lapse your membership. So much great information continues to come our way. All righty. Thanks so very much. I think we can say goodbye till next time. Thanks.
Okay, thank you.